Chris. Welcome to Xccelerate podcast. I'm Dr. Anil Jain, Chief Innovation Officer of Innovaccer. Tell us a little bit more about yourself.
Yeah, Dr. Jain, thanks for having me, and it's great to be here at the conference again, and always exciting information coming out. So happy to be here. Chris Holberg, I work for Ascension. I'm the director of their population health and managed care technology portfolio, and my background in healthcare over the last 25 years spans from clinical healthcare to quality and population health to starting and building population health programs and HCC risk, and models and CDI work. And so really excited now in this role that I'm in to be able to work more on bridging the gap between clinical and operational care and the technology that we use to support all of those functions.
Those are a lot of three-letter acronyms: CDI, HCC. And as the liaison between the clinical folks and the operational folks trying to make all the technology work for them, how do you approach that? How do you even begin to address the needs that you might have around the data, the analytics, and the various workflows?
Yeah, I mean, it's a great question. So we try to approach it with a lot of questions ourselves. So in our case, our business partners within Ascension might come to us and say, we have a goal or we have a specific need, and we're looking for a technology that can support that need or get us to that goal. And we'll answer their request with more questions. Tell me more. Tell me in what way. Tell me which EMRs we're talking about, because at Ascension we have pretty much all of the EMRs. And so sometimes it's, do we need an EMR tool? Because that is appropriate for some others. Or is this a market level need that really might need to turn into an enterprise-wide need that we need to address with some sort of large tool or platform? So we usually just kind of start with some additional questions to understand what our business partners need, and is there something we currently have that might fill that need, or do we need something new?
Well, I love the fact that you're user-centered. I imagine that's a very agile process. The answers may vary from month to month, year to year. It sounds like your EHR is an essential piece, but maybe insufficient for the full gamut of what you're trying to do around those three-letter acronyms. The HCC coding obviously is for the risk adjustment. The CDI is for the clinical documentation improvement. Tell us what else you need in order to have a robust strategy that you're helping the clinicians and helping the technology teams bring together.
Yeah, I mean, EHRs are great, and everything has its good and bad, right? But for a large organization, it's a little bit unrealistic to think that we're going to be all on the same instance of any version of an EHR across our organization. And because of that, we have obviously recognized that we need the capability to bring together data sources into a platform that can then normalize, standardize, and feed it back to us in multiple ways as well. So I've got to feed things to Epic, I've got to feed things to Cerner, and et cetera, et cetera. So we've been working for the last couple of years to kind of formulate a strategy around how do we pull together all of this disparate data and use it in the most effective way to generate actionable insights for our staff.
And tell us a little bit about the partners you need to come to the table to make that happen successfully.
Yeah, that's another great question. So the most important thing for us was finding partners that wanted to be just that with us. I think it's common to work with a vendor that seems a little bit more prescriptive in a restrictive way to say, like, well, this is the way you can do it and this is the way you can't do it. And we look for partners that want to partner with us and are willing to innovate with us as well. I mean, Ascension, being a large organization, has a lot of internal resources, but we also recognize that we can't build everything for ourselves. So we look for a partner that really wants to be a partner with us and build something with us.
So as you think about the change management required for your technology customers, your clinical customers, to be successful as you liaise between them, what is a successful model of engaging the various partners, the technology partners, like us, for example?
So for us, because we are, each of our markets is a little bit different. Each of our needs is a little bit different in each market. Um, it's important for us to have a model, a partnership model that allows for the flexibility to say, in Indiana, we need to do it this way because they bill their TCM codes in this manner through their EMR in this way. Whereas in Florida, we need to do it this way. So I think one of the most important things in that partnership model is that flexibility for fitting the right peg in the right hole in the right place.
Well, that's a good way of putting it. It sounds like that alignment is incredibly important. If you were to think about some of the various programs that you're supporting today and the programs that you might be supporting tomorrow, we have a new administration. There might be new value-based care programs. There might be new ways of doing a variety of different activities. What do you look for in the kind of data platform, the kind of analytics platform, and even let's bring AI into the mix in terms of AI platforms? What do you look for in that type of solution and partner?
So I think first and foremost, we're always looking for something that is speedy enough to give us data that is actionable, right? I mean, there's always that data lag problem that we're always trying to avoid, right? Accurate enough that it's not immediately, struck down by our end users because it's incorrect or wrong. And then also the user interface needs to be something that doesn't require logging into another system or looking at a different screen or, asking somebody else to help me remember my password to log in this other thing so that I can look at this information. I think it's got to be easily accessible, accurate, and timely for us to be able to really use it to generate value in that moment when, say, a provider is meeting with a patient that day. Because outside of that 15-minute visit, it's hard to get the patient on the phone or get the physician to look back at the chart for us or something else. So we have a limited moment to try to capture that information.
So I think it makes complete sense. I mean, asking physicians to log into multiple systems obviously is a non-starter. There's also an old saying that if you put 5 physicians in a room, you get 10 opinions. So how do you deal with trying to balance out creating a standard way of approaching the workflow and the very opinionated clinicians that might have their own way of doing things?
Yeah, that's the ultimate tightrope walk, honestly. And for some of it, it's, we have to create a standard of no standard. And that's hard. I think, everybody wants to have some form of standard, but to your point, every physician has their way of doing things. And for an organization like Ascension to really try to create standard workflows or standard pathways across all of our workflows is pretty difficult. And so where we can standardize, we look to standardize, whether that's protocols or assessments or things like that I think are easier to standardize. But when it comes to things like, blocking off time slots on your schedule for annual wellness visits, we allow flexibility there and leave that really up to the physician and the market to make decisions on.
Tell me a little bit more about the protocols and assessments that you were speaking to. What do you mean?
Yeah, so nationally we have we've built 14 different protocols within our Innovaccer platform that we're building today that we will put out there for all of our markets to use and utilize. But then at the same time, we recognize that each market might need to add some customization to each one of those protocols. So we kind of set the standard as a baseline and then allow our markets to tweak and add and customize where they feel like it's necessary.
So you can have your cake and eat it too.
Exactly.
It sounds like you're getting some standardization, but you're also allowing for some localization, regionalization.
Exactly.
Recognizing that at the end of the day, almost all healthcare is local.
Exactly.
Yeah,
Exactly.
That's awesome. And you have any early results of how that's going?
Well, we are really early still. I mean, we don't have any of our markets live with our Innovaccer platform yet. We're still building, but we're hoping to have our first market live here in the next 6 to 8 weeks. And we're very excited to kind of get that up and running and start getting the feedback from the end users in terms of like what's exciting, what's not exciting, what works and what doesn't, so that we can go back then and iterate on that process and make improvements where we can.
And how has the journey been to get to this point?
It's been really good, actually. We've had experiences with other population health vendors in the past, and we are honestly most excited about the partnership that we have with Innovaccer. As I mentioned before, that was a cornerstone of our decision process for picking a vendor because it's been a rough road for us in the past. And so it's really been nice to partner with somebody that is willing to sit down with us and really learn about our organization and what we're trying to do, and then is flexible enough to say, yes, we can do that there, and we can do this here, and we can make all of this work.
So we're really excited to have you as a partner as well. I think one of the things that I'm often struck by as a clinician, when I think about your role, I'm a little bit envious, because in the early days of implementing electronic health records, I don't think we figured out that the liaison role is so important to bring the technology side together with the clinical side. Do you have any battle scars you'd like to share?
Oh, yeah. I don't know if I want to share them, though. There's a lot of trauma.
You can mask the people involved if you like.
It's a really, I would say, over the last 10, 15 years, as healthcare has evolved to become a tech-dominated industry, that change has been difficult at times, but it's been very positive as well at times. And so there's always those instances where, I've had to go and speak with end users, whether it's, nurses or physicians or even executives, and explain why something is the way it is, or even you kind of touched on it earlier, talking about, administrative changes, why a particular program is changing the goalpost, or why it is that we're not meeting the goals that we're setting out. And it's hard, but I think that, the most important thing is to be able to have a conversation that is open and honest, that shows the information, right? So one of the most important things for us also in our partnership is we want to be able to have access to all the data, because we want to also be able to show our physicians, our end users, our executives, here's all the data, here's where it goes, here's where it's at. It's an open book rather than kind of this black box of IT, and we don't know what happens in there, but they're telling us we didn't do it right. We want to kind of break down those barriers by just having open, honest conversations.
That sounds like a lot of fun. And it sounds like the transparency that you're providing in terms of when you work with the technologists and the clinical teams. Clinical teams, if I remember from my days as a full-time clinician, we were very demanding. and the technology teams, they were trying to balance some of the needs across the entire organization. So it sounds like you have a very fun job. Is there any risk of ChatGPT replacing your job?
Boy, I hope not. I don't think so. Who knows what AI is going to do for us in the future? But I don't think that the human component will ever come out of it. I mean, I think that there are areas where AI can be incredibly helpful for us in the healthcare industry. Things like prior authorizations is an area that is a massive time and resource suck for organizations like Ascension, but can really be optimized by an AI tool that can help check for the right lab work before a surgery, or the imaging work, and making sure those things are all lined up for us, and then bring it to the right person to say, we have three of these four things done, double check it, and let's figure out what needs to be done before we can schedule that procedure. So I think that there are areas where AI is really going to enhance our capabilities, but I don't think that it's going to take over anybody's job yet.
Well, that's great to hear. So when you think about AI and you think about the different use cases, you mentioned the whole idea of prior authorization. The numbers I've heard out there is that it's approximately $20 for every provider to go through one of these prior auths. It's about $20 for the health plan to do it. And it's a huge waste of time for the patients and their families. So it's like one of these win-win-win situations if we can really tackle this. And I think utilizing AI like you're suggesting, I think is a great idea. How is your organization approaching the governance around AI? What if one of your physician colleagues wants to bring in a tool, or another colleague wants to bring in a tool? How does that work?
Yeah, so for Ascension, we have several committees that are managing the government of just specifically AI and how we're going to deploy and where and when. And I think, like a lot of large organizations, we're cautiously optimistic about AI, a little bit nervous about how do we deploy it, what will the regulations be. You mentioned changing administrations. it's always a little bit up in the air in terms of like, okay, what are the restrictions or the rules that we need to make sure that we're following? But also at the same time, I think all of us in our mind are thinking about where would be an amazing use case like prior authorizations, or some of that ambient listening in the clinician's office is a fantastic opportunity. But also our care managers could greatly benefit from ambient listening, or having an AI tool that is filling out the protocol for us as they're talking to the patient, or filling out the PHQ-9 for us as we're doing that assessment over the phone. And so I think that we all are very excited, but just kind of waiting to see when these tools are out and available and what the government says we can and can't do.
So cautiously optimistic,
Yeah.
and we're certainly aligned with that as well. So let me ask you a final question. So imagine you're giving advice to a younger self who's about to embark on a career where they're going to be the liaison between technology and clinical. What advice would you give them?
That's a great question. I think I would say chaos is not your enemy. There's always a bit of chaos. And instead of trying to put your arms around it and control everything that's happening, all the changes that are inevitably happening, I think of it kind of like swimming in the ocean. Don't fight the wave, go with the wave, and find those resources, particularly find the clinician that is incredibly interested and engaged in the technology to have conversations with and be a champion for you, because it's incredibly important to find, both within the organization and outside of the organization, who are the partners that are going to help you get to that end goal that you're trying to get to.
Well, that's fantastic. Chris, I really enjoyed the conversation, and thank you for being such a valued partner for Innovaccer.
Yeah. Dr. Jain, thank you so much. I appreciate your time.
Well, this concludes our Xccelerate podcast. See you next time.